One of the most common questions that patients always ask us is, how long will recovery take? And while that sounds like a simple question, the truth is, recovery timelines in plastic surgery are not one size fits all. Hello, I am Dr. Timothy Shim, Director of Plastic, Reconstructive and Aesthetic Surgery at Eagle Aesthetics and Surgery. And today, I will be sharing why different procedures heal differently and why recovery is rarely linear and why comparing timelines can sometimes do more harm than good. Want to hear more from our doctors at Eagle Aesthetics and Surgery? Subscribe to our channel for more insights on topics ranging from aesthetic medicine to oculoplastic and plastic surgery. When patients ask about recovery, what they are often really asking is, when will I feel normal again? But in surgery, recovery does not mean just one thing. Recovery happens in different phases, and in each phase, it follows its own timeline. The first phase is early recovery. This refers to pain, discomfort, and the early post-operative phase. This is when swelling, bruising, and tightness are most noticeable. For many procedures, this phase settles within days to weeks, and patients begin to feel physically more comfortable. Then, there is the late phase of healing, which is the longest and least visible phase. Internal tissues continue to remodel, scars mature, and swelling slowly resolves at a microscopic level. This process can take several months, and sometimes up to a year, depending on the procedure. Another phase of healing that is not often mentioned is functional recovery. This is when you can return to daily activities, such as going back to work, exercising lightly, or moving without restriction. This often happens before healing is complete, which is why surgeons still place activity limits even when patients feel they are able to do it. And finally, there is this social recovery. This is when you feel comfortable being seen in public. Bruising has now faded, swelling has reduced, and you feel like yourself again in social settings. For many patients, this is a very important milestone, but it's not the same as full healing. These phases often overlap and they do not progress at the same speed. You may feel fine physically, but still may be healing internally. You may look ready socially, but tissues are still settling underneath. So recovery is not a single finishing line, but a gradual process. Why do different procedures go through the healing process differently? The biggest factor influencing recovery is what tissues are involved. Procedures that mainly involve the skin and superficial tissues tend to recover faster. In contrast, surgeries that involve deeper structures such as muscle repositioning, internal sutures, or extensive tissue reshaping, remodeling naturally takes longer to settle. For example, facial procedures often involve delicate tissues with excellent blood supply. Therefore, it can heal relatively quickly but also swell easily. Body contouring procedures may involve larger surface areas, leading to prolonged swelling and bruising. Breast and reconstructive procedures often involve healing of the internal tissues as well, that is not visible on the surface, but still requires the time for it to heal properly. The more phases are involved, the longer the recovery tends to be. Swelling is one of the most misunderstood aspects of the recovery phase. Many patients feel discouraged when swelling lasts longer than expected. But swelling does not mean that something has gone wrong. It is a normal inflammatory response and part of the usual healing process. Different procedures create different patterns of swelling. Some swell early and settle quickly. Others improve gradually over months. Swelling can also fluctuate, improving one week and appearing worse the next, which can be unsettling if you are not prepared for it. This is why recovery rarely follows a usual straight line. Why recovery looks different between patients even for the same procedure. Recovery can vary significantly between different individuals. Factors that influence healing include genetics, skin quality, age, general health of the patient, whether you smoke or you do not smoke, and most importantly, adherence to post-operative instructions. Two patients undergoing the same surgery can have very different recovery experiences, and neither is necessarily wrong or abnormal. This variability is one of the reasons surgeons give ranges rather than exact timelines. Another common misunderstanding is the difference between social downtime and the medical or physiological recovery. Social downtime refers to when you feel comfortable to be seen in public. This time is when swelling is reduced, bruising has faded, and you look presentable. Medical or physiological healing, however, continues well beyond this point. Internal tissues are still settling, scars are still maturing, final contours are still evolving. Feeling fine does not always mean that healing is complete. Why comparing recovery timelines can be misleading. With social media and online forums, it's very easy to compare recovery to someone else's. This can create unnecessary anxiety. Recovery timelines shared online often lack context. Differences in anatomy, procedure extent, or even lighting and angles can make recoveries appear faster or slower than they truly are. A good recovery is not defined by speed, but by safe healing and stable, predictable results. When surgeons discuss recovery, we consider the procedure itself, the extent of the surgical surgical work and dissection needed, the patient's baseline health characteristics, and lifestyle factors. This is why a personalized discussion is very essential. A realistic recovery plan helps the patient to prepare both physically and emotionally for the healing process. Healing after plastic surgery is a process, not an event. Different procedures heal differently, and even with the same procedure can look different from one patient to another. What matters most is safe healing and proper follow-up and patience. With an experienced surgeon and careful post-operative care, most patients recover well and achieve outcomes that continue to improve over time. If you are considering surgery, understanding recovery timeline is just as important as understanding the procedure itself.